One of the hard things for me after waking up paralyzed was closing my eyes. I found when I closed my eyes, my body no longer existed, so I couldn't sleep. Anytime the sheets would get pulled up over my body disappeared. Those things were very alarming. So I couldn't ever sleep with the sheets over my legs. That was very alarming. So once I got home, one of the things I would find is I would wake up from a couple hours of just pure exhaustion. I haven't slept in 20 something hours. And finally, I'm going off to sleep. And suddenly I realize, oh my God, I'm waking up and I'm realizing I don't know where my body is.
This is the Recovery After Stroke podcast with Bill Gassiamis, helping you navigate recovery after stroke.
Hello and welcome to Recovery After Stroke, a podcast full of answers, advice, and practical tools for stroke survivors to help you take back your life after a stroke and build a stronger future. I'm your host, three-time stroke survivor, Bill Gassiamis. After my own life was turned upside down and I went from being an active father to being stuck in hospital, I knew if I wanted to get my life back to the one I loved before, my recovery was up to me. After years of researching and discovering, I learned how to heal my brain and rebuild a healthier and happier life than I ever dreamed possible. And now I've made it my mission to empower other stroke survivors like you to recover faster, achieve your goals, and take back the freedom you deserve. If you enjoyed this episode and want more resources, accessible training, and hands-on support, check out my Recovery After Stroke membership community. Created especially for stroke survivors and caregivers, this is your clear pathway to transform your symptoms, reduce your anxiety, and navigate your journey to recovery with confidence. Head to recoveryafterstroke.com to find out more after this episode. But for now, let's dive right into today's show. This is episode 167, and my guest today is Jeffrey A. Morse, who experienced a spinal cord stroke due to complications from brain surgery that was meant to deal with a brain aneurysm. When he woke from surgery, Jeffrey was paralyzed from the neck down. Jeffrey Morse, welcome to the podcast.
It's a pleasure to be here, Bill. Thank you for inviting me to your show.
Yeah, my pleasure. Thanks for being here. Tell me a little bit about what happened to you.
Well, back in June of 2012, everything started with a headache, which turned into a migraine, which turned into the worst migraine of my life. And I went to see an ear, nose, and throat specialist for a scuba diving incident that I had. And when I told him about the headache, he said, I don't deal with migraines. Our meeting is over with. Go see your family doctor. Next morning, I see the family doctor, and he is very concerned because he can tell I've more than likely have an issue with a aneurysm. So I wind up at the hospital, and this began a series of events of fate either turning left or right, depending on which direction you either lived or you didn't. And next thing I know, I'm down in Charlotte, North Carolina in the neurosurgical ICU wing for the next 10 days. With the doctor trying to use medicine to reduce my aneurysm. And when it wasn't working, he finally told me, all we have left is a surgery, and you've got less than a 25% chance of surviving. When I woke up after the surgery on July 9th, I was paralyzed from the neck down. So while they were operating on me, they caused a spinal cord stroke and paralyzed me from the neck down. The aneurysm was fixed, but my journey was only beginning.
Golly. In Feb 2012 is when I experienced the first bleed in my head, caused by an arteriovenous malformation. So different from a aneurysm. Aneurysm is a bubble, I suppose, that grows on the blood vessel, and then as it gets larger because of the blood pressure, it tends to thin out the wall of the blood vessel, and then eventually what happens is it might burst. But until then, sometimes it can create symptoms by pressing on different parts of the brain, depending on where it is, and kind of showing itself before it bleeds. But for a lot of people, it doesn't. It just actually ruptures and their aneurysm bursts, and then it just bleeds out. And usually aneurysms are on blood vessels or on veins or arteries that are quite large. And usually the bleed is catastrophic. So did you know that you had this aneurysm in your head, or was that something new that was discovered after this supposed headache or migraine?
Well, when I went to the emergency room doctor ordered a CAT scan on my brain. And when they took me down, the lady performing the procedure uh, knelt down to me. I had a blanket over my head. I couldn't handle light anymore. She knelt down and whispered in my ear. I was told just to do one uh, picture of your brain, but I decided to do one of your neck as well. And thank God she did that, because what did they find? They found the aneurysm on my right vertebral artery, and just above the aneurysm, I had a dissection. So the blood was getting into the walls of the artery above the aneurysm itself, and the aneurysm was quite large. So I was very fortunate that she elected to do that to me. Otherwise, I wouldn't be sitting here today.
Okay. First angel in your life is this lady who does she has she done the wrong thing according to following orders or whatever, or is she allowed to take liberty and scan more than just your
It
head?
appeared she it appeared she had the liberty to do that, and thank goodness she did do it, because the doctor was already a bit high strung with everything going on. He kept calling down to the Charlotte Medical Center to talk to the chief of the neurosurgery department, and he was getting directions from that gentleman. And when he came in to initially tell me I had an aneurysm, it was, oh my God, you have two aneurysms. And it wasn't until I got to Charlotte that they told me, no, it's only one aneurysm and you have the dissection above that, which are both extremely serious. You're in critical condition.
Yeah, dissection is maybe not imminent of causing a stroke, but and necessarily because it causes blood clots mostly, to create behind the flap of the dissection, but also sometimes the blood vessel can break off and then that causes the blockage. So you had that going against you. You also had this aneurysm, all in the same location, and the 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 ticking time bomb kind of saying
Yes.
is really apt here. Definitely apt.
Yes, I was without a doubt a ticking time bomb. I was in a room for 10 days with a nurse looking through a window 24 hours a day at me. Every time they would come in every 4 hours to give me medication, I had to go through the series of questions of what day of the week is it, what year is it, who's the president of the United States, those types of questions before they would give me my medication. And they were also lowering my blood pressure from 120 over 80 down to, if I recall, 70 over 50, to try to reduce the aneurysm in that manner. However, it wasn't working.
Yeah. And how old were you?
49.
Yeah.
49 and in the best shape of my life. Worked out every week, lots of cardio, scuba diving, very active, very healthy, ate well, uh, nothing wrong. And when I asked the doctor about that, while all this was going on, he just said, sometimes it just happens. You were doing everything right. Had you not been doing everything right, you probably wouldn't be here right now.
Yeah, absolutely. That's the one thing that I find with a lot of stroke survivors who I interview is this whole idea that just because you're fit and healthy and you do all these things, it doesn't mean life's not going to happen to you. It doesn't mean that
Correct.
you're immune from life and from wear and tear in other parts of your body that are not related to your lungs and your fitness and your muscles and all that kind of stuff. And especially when you have an aneurysm, it tends to be something that is something that you're born with, this weakness in this one spot that just happens to get weaker and weaker over time, which is similar to an arteriovenous malformation or a cavernoma. So there's a whole bunch of reasons why this outward appearance of health isn't necessarily accurate to what's going on. And it's not to say that just because you have an aneurysm or an AVM, you're not healthy. It's just to say that it doesn't mean that you're immune from life.
Very true. One of the things I kept thinking about was I was so glad I wasn't someone with high blood pressure. If I went into this with high blood pressure, what would the outcome have been with this? I was so fortunate that I did have good blood pressure, and yes, I had health going for me, but this was out of my hands. Fate was totally in control and at the wheel here, and all I could do was just let things unfold and hope for the best.
Are you in hospital actually doing that, hoping for the best, praying for the best outcome? I didn't go down that path at all. I just accepted my fate. I'm not sure whether I was going to be happy with the outcome if it ended in me passing, but I definitely just accepted it. I accepted my whole situation, and I don't know why or how I got there. So people ask me, I haven't really contemplated how or why I got there. But over the 3 years and 3 brain bleeds and then brain surgery, I just accepted every single aspect of it. I never fought it. I never said, why me? What were you like?
I didn't fight it. Thankfully, at that point in time in my life, I lived a good life. I traveled the world. I spent time in the military traveling the world with the Air Force, spent time with a few different cargo airlines flying worldwide. So I really lived a very good life with no regret at all. And yes, I accepted if this happens, it happens. I wasn't living a life full of regret. I wished I had done this or I wished I had done that. I was fully accepting of if it happens, it happens. But if it doesn't happen, I'm not going to let this define me. I hope it doesn't happen. I want to continue on with my life. But if it does happen, I'm going to find another way around, and I'm not going to live my life by I can't. I'm going to continue on and live this life of mine.
Yeah. So you're in hospital 10 days. They're trying to settle things down. And then what happens? Do they decide that now we've got to operate? How does the next part of the phase go?
So they finally figured out after as the 10 days was going on, the aneurysm was not decreasing in size, and the doctor was having to weigh every day, do I go in and do the surgery now, or do I try to give it a little more time? Each day knowing that the aneurysm could burst or something could happen with the dissection in the artery right above it. So the decision was finally made, let's do the surgery. So I did that on the morning of July 9th. And when I woke up, I realized I couldn't move anything. I could tell my brain, or my brain could try to tell some part of my body to move, but it wasn't moving. And I quickly realized that I was paralyzed. I was having great difficulty breathing because it affected my diaphragm, and my ability to inhale and exhale were very difficult. I felt like I had a thick leather strap wrapped around my chest with somebody pulling it as tight as they could, making it more difficult for me to breathe. So the first few hours were extremely difficult. claustrophobia takes over. You can't move your body. Fight or flight is in full gear. And now you've got to figure out what's next. Are you going to let this define you, or are you going to start figuring out how to move forward? And the next piece of that was, hey, there's no instruction manual for this, as far as what do you do first? What do you do second? How do you find your way through this? And that was when I started saying to myself, I need to find my way forward through this. And I think what I'll do is I'll write an instruction book about this. So I'll figure out someday how to journal about everything going on. And maybe I can write something to other people that are just starting this and trying to figure out, how do I move forward through this journey now?
So you said exactly what one of my previous guests said. So I interviewed Dr. Bradford Burke, who is a spinal injury survivor, and he said that when he was in hospital, the first thing that came into his mind was about the book he was going to write about his experience. And it was episode 164, so not that many episodes ago. And I just said to him, how does that become the first thing in your mind? And you've got all this other stuff that's going wrong. But of course, as a spinal cord injury survivor, he was also paralyzed from the neck down. And that's the first thing that came into his mind. So I find this really bizarre.
Yeah, I told myself, with everything that was uh, with the trauma that was coming into my brain, making it difficult to think clearly and to start formulating a plan, I didn't need to let that take over. So I needed to put my brain someplace where I could start formulating a plan. And I thought, if I can keep my brain there, then I'm not going to lose it. So start building this mousetrap in your brain and keep thinking about that, and don't think about this other thing that is horrific beyond words. So if I could keep doing that, then I could maintain my myself and not lose it.
Mm. So it's a survival mechanism. But is that your training as well? Because if you've been a pilot, if you've flown for the defense forces and commercially and all that kind of stuff, surely they're teaching you that, you got to remain calm and you got to find your way out of a difficult situation should you find yourself in one. Is that something that you think played a role with this place you found yourself in?
Yes, it absolutely played a role. Survival school in the military played a role. SEER training, that definitely played a role. It taught me who the inner me was. That training let a different Jeff out. And when I was face to face with that person, I knew what I could do if I set my mind to things. And same thing with flying. When you are in certain situations, flying into mountainous terrain in South America, or some of the other things you deal with around the world with weather and terrain, as an example, you've got to keep flying the airplane. No matter what, you've got to keep flying. You've got to fly that thing all the way down to the ground and figure your way out of whatever is going on. So yes, to answer your question, that absolutely played a very large role in my recovery.
Yeah. I've become familiar with this Stoic saying, from the ancient philosophers 2,000 years ago. They talk about the obstacle being the way. And, for bad weather is a perfect example of that. You're in the obstacle is right there. And you've actually got to go through it. You can't do anything. You can't turn around. You can't go back to base. You've got to continue your mission. You've got to go through, around, above. I'm not sure how, but you got to get through the obstacle. And that stuff that's lying on the other side of the obstacle is where you're headed no matter what. And you wouldn't just stop walking on a, you guys call it a sidewalk, we call it a footpath. You wouldn't just stop walking on a footpath just because there was a big boulder on it. You'd pay attention to the boulder, you'd find a way around it, over it, under it, whatever, and then you'd continue walking on that footpath with no real difference in your mindset as to where you're heading or going. Is that kind of, does that relate?
Oh yeah, absolutely. It even related months later. Well, the end of that year, I promised my niece and nephew that I would be with them to go to Paris. And no matter what, I was going to figure out how to walk. And if I couldn't walk, well, then it's the wheelchair. It was ugly, but I was walking while I was over there. And one day we find ourselves at the top of the Notre Dame Cathedral. And once we're at the top, it's time to take the spiral staircase down. And I find the handrails on the wrong side of the spiral staircase. So I needed the handrail on my left, and the handrail is on my right.
If you've had a stroke and you're in recovery, you'll know what a scary and confusing time it can be. You're likely to have a lot of questions going through your mind. Like, how long will it take to recover? Will I actually recover? What things should I avoid in case I make matters worse? Doctors will explain things, but obviously you've never had a stroke before. You probably don't know what questions to ask. If this is you, you may be missing out on doing things that could help speed up your recovery. If you're finding yourself in that situation, stop worrying and head to recoveryafterstroke.com, where you can download a guide that will help you. It's called 7 Questions to Ask Your Doctor About Your Stroke. These 7 questions are the ones Bill wished he'd asked when he was recovering from a stroke. They'll not only help you better understand your condition, they'll help you take a more active role in your recovery. Head to the website now, recoveryafterstroke.com, and download the guide. It's free.
So I knew this wasn't going to work. So now how do I facilitate getting down to the bottom and getting out of the cathedral? So all I did was turn around and do the spiral staircase backwards. So just make it happen. Don't sit there and languish over it. Figure out a way to build a better mousetrap and make that thing happen and enjoy it along the way. So yes, it's totally relatable to everything that you're saying. Absolutely everything.
And the French are going, these Americans, look at them walking backwards.
That's right.
In a cathedral. How could they do that? They would have had a specific huss or cuss word specifically just for that situation.
Well, and it was funny because my niece along the way said, you know, you're walking too slow. I'm going to go on ahead. I'll see you at the bottom, and just left me and my nephew there. So yes, you know, great time, but this is all part of living your life. Figure out how to make things happen so you can continue on and be happy.
I'm going to get back to that French trip, but before we get there, I just want to understand, so the timeline. So you wake up, you can't feel from your head down, nothing's working. Are you locked in? Do you have the ability to speak?
Yes. Yeah, all my cognitive abilities were still there. Breathing was difficult because of the diaphragm, but I could speak, I could think. Eye movement, all great. No sense of temperature, pain, or any of that anymore. All that was gone. I could communicate quite well. One of the other things that was funny about that was a few days later, a cognitive specialist came into the room while a friend of mine was visiting. One of my scuba diving buddies, Charlie Brown, who was a
Snoopy's friend.
Yes. So he was at the time a police officer, and the hospital was in his patrol area. So he would come visit every day. And on that particular morning, the cognitive specialist comes in and says, hey, we need to check your cognitive ability. One of the first things we're going to do is have you count back from 100 by 7. So by the time I finished, my friend Charlie is still stuck at 86, trying to figure out what the next number down was. And we just laughed about it. So, yes, I couldn't move, but I could sure do math awful well. So none of that seemed to bother me.
Yeah, it's what a perfectly useful thing to have, the ability to do when you're paralyzed from the neck down.
At least I can do math. Yeah.
Yeah. Calculate the number of days I've been here, or the number of days to my release, or I'm not sure what, but I know where you're heading with that. That's great. So how long did you spend in hospital?
I was in the hospital 6 weeks. When I woke up from the surgery, the surgeon told me, I have good news. You survived the surgery. However, it appears you're paralyzed from the neck down. You may never walk again. And I looked at him right in the eye and I said, I'll walk out of this hospital. And he tapped me on the shoulder with his hand and walked away. So I made that promise to myself. And at the end of the 6 weeks on August 9th, I walked out of that hospital. They wheeled me up to the front door. I grabbed my walker, and yes, it was ugly, but it was still one foot in front of the other. And I made it out to the car and made my way home.
I love that. Yes, it was ugly attitude, because that is the attitude that's going to get you to France. It's going to get you to a trip around a lake in a boat. It's going to get you to a cafe having a coffee with family and friends. It's going to
Yes.
get you to all the places that you need to get to as a human being to experience just the small joys of life. And I've noticed what I've missed the most during lockdowns and COVID and all that kind of stuff is just getting out and connecting with people. And now that we've come out of the most locked down city in the world, I think, something like a couple of 100 days or something, some ridiculous amount of time, it's a bit of a struggle to get back into the routine nature of, hey, are we going to go somewhere and do something and catch up? And it's bizarre that even me, I find it weird that I haven't been able to bounce back into that thing. But when I was recovering from stroke, no matter what condition I was in, as long as I had the energy to do it, I never said no to anybody. Whatever somebody wanted me to go somewhere, do something, see something, I always said yes. The only thing that stopped me was fatigue. Did you have fatigue issues as well? Because I imagine that walking in a walker after 6 weeks of rehabilitation is going to be pretty draining on you physically and mentally, and maybe even emotionally. I'm not sure.
Fatigue definitely was a factor. So when I got home, one of the things I started noticing was my brain was all in and wanted to go do things, but my body was saying, hey, I'm fatigued. I can't do what you're asking for. And what I found of that was I had a good, honest 4 hours a day where I could do movement. And then my body would say, I'm done. I need to rest. The other thing that I found that manifested itself during that time was something called phantosmia. So the phantosmia, uh, that's your olfactory system hallucinating. And I would start smelling what smelled like burnt toast. And anytime my brain was fatigued, the phantosmia was there. Over time, that went away. But to this day, I still notice it when I'm getting a little bit more back and my brain is figuring out how to talk to this new part of my body, a part of a muscle, uh, bringing a couple of muscles together to start working in unison together. I'll notice the phantosmia kick in a little bit there. And it's continuing to tell me that, hey, things are still getting better. So it's a good sign. But yes, in the beginning, I definitely had issues with fatigue.
Yeah. So what about now? Do you have any days where you feel strange and out of it and kind of woo woo and all that type of thing? I know it's nearly 10 years later. How are you doing today? So, uh, just to paint the picture for people that are perhaps starting this journey or of a little bit of a way down their own journey, what's it like nearly 10 years later?
It's a lot better. I still notice the fatigue a little bit here and there. I work for an airline. I'm an instructor at an airline, so I spend 8 hours a day in a classroom, standing, walking around, talking. At the end of the day, go home, uh, do a little workout, do a little cardio, and then call it a night. If I want to go out and do something, I'm going to do something. 4 years into this, with all of the work that I was doing, my own therapy program with things like Pilates and um, neuromuscular massage therapy, um, I finally got to a point where I was finding 4 years in, what was holding me back was the medication. It was the side effects of the medication that was holding me back more than anything else. And once I got the medication out of my system, things changed drastically. As a matter of fact, when I did that in June of 2016, I finally decided 3 months later when I got off the medicine, it's time to take a trip. And I planned a trip to Nepal, a 2-week trip to Nepal. So, and I lined up all sorts of activities to do. And I told myself, hey, if I can do those activities, great. If I can't, well, that's fine too. At least I tried.
Mm.
But that was 4 years in. Now I feel monumentally better. Do I still feel fatigue? Do I still have limitations and restrictions?
Mm-hmm.
Sure, but they're nothing compared to what they were in the beginning. And the one constant I found of this throughout is the neuromuscular massage therapy. And what I found of that is uh, when I get that done, breaking down the fascia in my system, which appears to go rampant when the sympathetic nervous system is trying to protect you. It's constantly trying to give you that stability through the fascia. But what's the other thing the fascia is doing? It's cutting off the circulation to your nerve endings or your nervous system. And with having that broken up, it's giving me the ability to regain those muscles, regain the nervous system doing what it's supposed to do. So I've been doing that for over 6 years. And to this day, I still see gain out of that.
Yeah. I find myself, my left side is the affected side, and it's the, nobody would know if they saw me, but it gets tight and it tries to keep me upright all the time. It overcompensates. It tries to help stabilize me and keep me balanced, which in fact causes the opposite effect. Um,
Yes.
and when it gets really bad, it starts to hurt way more than it's ever hurt. And the only thing that relieves it is some real deep tissue massaging. And it's pretty interesting to go and have the conversation with a masseur who has never touched my body before. And they're going, well, I've never had somebody who's so tight on one side, it's so loose on the other side. So I really relate to what you're saying about how having muscle work done and lengthening the muscles and stretching the muscles and moving them in these different ways supports stability and supports core muscle, core strength, and supports all those things that help keep us upright.
Yes. And the other thing I found of it over time, I was trying everything from going into a gym, trying Tai Chi for balance, yoga, Pilates. Pilates, workout wise, was the absolute best
Mm.
because it was working those smaller stability muscles. I didn't need to work the larger muscle groups, I needed the smaller muscle
Mm.
groups. And I found I was in a very safe environment doing that type of workout. And that in conjunction with the neuromuscular massage work was perfect. The other thing that I found that was really great was dry needling. The dry needling would break down the fascia as well.
Uh-huh.
And those three things, they were the peanut butter, jelly, and bread all together. All three of them worked perfectly. And
Mhm.
those were the three things overall of everything that I tried that worked the best.
Okay. Dry needling, I've had the experience. It's pretty cool, bizarre and weird, but at the same time, strangely relaxing and comfortable, and definitely felt positive, or something positive happen because of that session.
Yes, yes. It's amazing what it releases, what all three of them do.
Mm.
The neuromuscular massage work above all the things that I tried,
Mm.
that walking away from one of those sessions 90 minutes later or 2 hours later, what I felt in my body, the reduction in the restrictions, how I felt overall, mindset wise, I felt more positive. I could breathe easier. That made things a lot nicer as well. So I still do that every week, and the results are always spectacular.
Yeah. Let's go back to the medication that you said you uh, re- started to reconsider. How did you get to that? What made you think that this is something that we need to look at?
Well, I couldn't get over how rigid my body was. Uh, I was having so much difficulty moving a leg forward. Forget trying to bend the leg at the knee as you're attempting to walk. Um, I was extremely rigid. I noticed the depression and a number of other side effects. So I just decided, while I was trying to learn anatomy so I could speak the same language as uh, the massage therapist or the person working with me in Pilates, I wanted to find out about the medication as well. One of the other things I found was every time the massage therapist worked on me, she was finding it it was like trying to massage a walkway, a cement walkway. She couldn't get into my muscle structure. So I started finding the side effects of the medication with some of the meds were causing muscle rigidity. So one of the next times I went to see the doctor, I asked about it, and the subject was instantly changed. And it was suggested that I consider having Botox injections in the back of my right leg and into my hamstring muscles. It was equally suggested that I consider having my Achilles tendon sliced numerous times to release the rigidity there. So that's nice that you're suggesting that, but then what do I have to deal with for the rest of my life after that? Now I have dropped foot for the rest of my life. I'm going to be in a boot as a result of that. And what did it really fix? Nothing. So I asked again about the side effects of the medication. And again, the conversation was changed. So I just decided to take it upon myself to stop taking the medication.
All right.
A week
Stop
after I,
stop there for a sec. We do not advocate anyone stopping their medication on their
no,
own.
no, no, not at all. Not at all. I just found with me, with
Yeah.
some of this, that did I really need some of this? And I didn't. So a week later, all of a sudden, the muscles were pliable again. So,
Okay.
yes, that's just my case. Apologies.
No, no, don't apologize. I understand why and how you got there. We're not advocating it. Okay.
No, not at all.
Everybody else, speak to your doctor about it. And I get the issue that you have, the frustration that you have with your doctor, because many doctors go down that path. It's very rare for me to hear from somebody who said, I spoke to my doctor about X and we had a great deep conversation about it, and then I made an informed decision. Very rare. So I get why you did that. Now, I've also previously, before this part of my life where I had a stroke and became a podcast host and all that kind of stuff, I used to coach people as a life coach. And one of the people who I coached was telling me that they were on a medication, and this particular medication they were on for 10 years or something. And it was to treat an issue that happened 10 years prior. And it was okay. And has that issue resolved itself? And she said, well, yeah, I don't think I have that issue anymore, or something along those lines. Have you ever spoken to your doctor about stopping the medication or changing it or decreasing it or something like that? Mm-hmm. And she said, no. I said, is there a reason why? She goes, I just haven't thought of it. I take it religiously every day and refill the prescriptions and just go down that path. And I just thought that was so bizarre. And I said to her, well, do you think maybe, because some of the issues she was having were physical issues in other places and emotional issues and psychological issues. And I just thought, look, maybe you want to speak to your doctor and reconsider this medication because you've been taking it for so long and the issue that you had back then is no longer an issue. And it was news to her that she could even do that and that she even should do that. Nonetheless, she had that conversation and they both agreed that she no longer needed to take that medication. So I don't know how many years of unnecessary prescriptions she was filling and taking, but she was, and she just did not give it a second thought.
Yeah, and my only point with it was I was trying to get to the root of a problem, to try to solve a problem in my body. And every time I tried to broach the subject with a physician, the subject was changed. And all I was trying to figure out was, how do I get to the next level of improving myself and maybe reducing some more of these restrictions. So yes, I took it upon myself to do something. And what I found afterwards was, lo and behold, this particular thing I was concerned about was actually true. So, I was able to move on from it. So
it's important. Worked. Yeah, it's important that people do read the side effects of prescription medication of any kind, so that they just know that what's happening isn't perhaps them. It's not their lack of being mentally strong or emotionally stable or all those things. It's potentially being influenced by something else. And it's enough to tip some people over the edge and go into depression and go into all these places. So I remember when I was first diagnosed with the bleed in my head, I was prescribed dexamethasone. It's a steroid to reduce inflammation, but it has a list of about 40 side effects. And let me tell you, I experienced about 20 of those side effects within the first week or two. And before we got curious as to what the hell these drugs do, we just accepted it as maybe it's part of the stroke, maybe it's part of this, maybe it's part of that. We didn't know what it was part of, what was causing it. And then we Googled it, we found it online, and then we discovered that, okay, a lot of these things are related to the medication. The decision was made that you stay on the medication for a number of weeks because it was a critical time in my head to try and decrease the swelling, and then they wean you off it. But they have to wean you off it. They have to cut the dose down by half, and then by half, and then by half, and then by half, and then get it to the point where you're taking none of it, because it was that serious and that strong. I was having hallucinations at night. I could feel like stuff crawling under my skin. I was eating 24 hours a day, 7 days a week. I I put on, I think it was 8 kilos in 2 weeks, which I think is about 4 or 5 pounds. I was angry. I had insomnia, and I thought,
Yes.
it was all related to the stroke at the beginning, to what happened in my head. So I'm glad we spoke about that. And I'm just going to reiterate one more time before we move on. Please consult your doctor about
Absolutely.
any medications that you decide not to take.
Be your own advocate and do the
Yeah.
right thing. And
Yeah.
yes, have the conversation.
And if you don't like what your doctor has to say, get a second opinion. For God's
That's
sake,
it.
sack your doctor and get a second opinion, and find somebody that will work for you or with you and the way that you like. I certainly did that at the very beginning as well. I got rid of my doctor and found somebody that was going to work with me the way that I wanted to. That whole issue that I have with doctors is that that perhaps it's their training, and I don't have a real issue with them. I have an issue with some of the things that they do, especially that you may never walk again thing, because I know that not everybody's like you, Jeffrey. They're not all going to go, yeah, screw you, I'm going to walk again. It might get ugly, but I'm going to do it. Some people take it to heart, and that really bothers me that they don't take into consideration the possibility that the next person they say that to might be the one that's taking it to heart. Sure, some will get motivated by that, but a lot of people will take it to heart.
And that's my concern, is they're not in your body. They're making assumptions. Yes, they're very trained. Yes, we need them for the obvious reasons we need them. But at some point, you're getting out of that hospital, and you've got to take it upon yourself to take control of your life and say, okay, that's just one person's opinion. Great, you've got letters in front of your name, but it's still your opinion. This is my body, and I'm not going to live with that. I want to continue living my life. So yes, you've got to be your own advocate and find your way through.
Yeah, completely agree. So how long after all of this saga did you start writing the book, Finding Forward?
After I returned from Nepal in December of 2016, I met my ghostwriter. I hired a ghostwriter to sit down with me, and I began writing the beginning of March of 2017, and 5 months later, I finished. So I had everything in my mind about what I wanted to speak to, the audience I was trying to speak to, each of us that suffers from what we suffer through with these debilitating effects. And I wanted to speak to everybody about that and say, hey, your life's not over, and there are other means of going about living your life.
Yeah. Do you have a copy of the book there?
I do not, but I do have a copy someplace of the cover. I don't know if everybody can see that, but there's the cover of the book. And
pretty wicked cover photo there. Tell us about the cover photo.
So one of the days in Nepal, I went up to the top of Serenkot Mountain to go paragliding with an Egyptian vulture. And 6,000-foot mountain. It was myself and another lady who I found out later was also a survivor. So we're standing at the top of the mountain waiting early that morning, waiting for the winds to come up. And the two gentlemen that are going to take us out to do this, the owner of this company, this para-hawking company, was asking me, what brought you to Nepal? I told him my story. And the other lady going out overheard me, and she came over and introduced herself. And lo and behold, I find out she is a National Geographic photographer who many years earlier had a life-threatening event over in Laos She was going to cover a story, and a she was on a switchback mountain in a bus. A bus coming in the other direction hit her, and now she's telling me her story as we're sitting there. And the owner of the parahawking company was in total awe. And what I found of it was this was the first time I met another survivor. And one of the things I found very interesting about it was we were completing each other's sentences, right right down to the breathing and how difficult breathing was in the beginning. So it was real special. They rig me up and they tell me, okay, we're going to run down the hillside here to go airborne. And I said, well, I can't run. And they said, that's no problem. We can make that work. So the gentleman uh, controlling the paraglider for me asked two of his friends to grab the harness on either side of me, and they ran us down. And next thing we know, we were off the edge there, and I'm feeding this Egyptian vulture that they use to help them find the thermals so we can enjoy the gliding experience. So while we were doing that, the Egyptian vulture was going back and forth between our paraglider and the other paraglider, and we got to feed it in flight, look out to the north towards the Himalayan mountains, and enjoy a nice 20-minute flight down to the bottom. And when I finished, I went back into town, got on a bus, went back up to the top of the mountain, and went ziplining for the first time in my life.
Far out, man. I'm looking at the image of you in the paraglider, in the harness, and the bird is sitting on your arm.
Yes.
And somebody was in the right place at the right time to take a photo of that.
Well, he had GoPro cameras positioned around where he could take those pictures while we were flying.
Oh,
So
wow.
it was numerous pictures that he was taking while we were doing that. So yes, it was very fascinating, and I got to feel adrenaline and living again. All the hard work got me there. All the people that helped me get to that point allowed me to experience that again. And the other part of this book is me saying thank you to each and every one of them for getting me to that point to be able to do that.
It's a hell of a cover photo. It's just an absolute amazing photo there of just somebody experiencing life, and it doesn't have to be what everybody does. It's definitely not. I can appreciate how amazing it would be, but I can't find myself either jumping out of a perfectly good plane or jumping off a cliff. I just can't find myself doing that. And I appreciate the people that do, and I think you guys are amazing, but I just don't think that I'd be able to do it, Jeffrey.
Yeah, the whole trip was one adrenaline rush after another, and it was finding my freedom again, finding life all over again, meeting new people, doing things that some would say I would never do again, and I went there to do them, and
Yeah.
to find enlightenment, and I found all of that.
So before that, you would have experienced some isolation just as it's part of the course of being somebody that's going through what you're going through, and then being on the recovery side, say even out of the hospital when you're still not able to get out into life yet. Did you deal with isolation well? Is that something that you experienced? Because I imagine that you would have had those feelings more intensely at some point, especially when you're waking up and you've got no feeling beneath your neck.
Yeah, this was something that I dealt with a lot in the beginning. I still deal with a little bit of it even to this day. But um, one of the hard things for me after waking up paralyzed was closing my eyes. Um, I found when I closed my eyes, my body no longer existed. So I couldn't sleep. Anytime the sheets would get pulled up over my body disappeared. Those things were very alarming. So I couldn't ever sleep with the sheets over my legs. That was very alarming to me. So once I got home, one of the things I would find is I would wake up from a couple hours of just pure exhaustion. I haven't slept in 20 something hours. And finally, I'm going off to sleep. And suddenly I realize, oh my God, I'm waking up and I'm realizing I don't know where my body is. I think I know where my legs are, and they're nowhere near the position I think they're in. Uh, I couldn't sleep with lights off. I had to have the lights on. So if I did fall asleep and then I was jolted back to consciousness, I could look down immediately and reestablish where everything was at, where my arms were, where my legs were. Sometimes I might have an arm underneath me, pinned underneath me. And what happens when you do that when you're not paralyzed and you lose the circulation in your arm? Now I can't sense that. So all I can see is the arms pinned underneath me, and I have to ask for help to get the arm out from underneath me if I can't. So it was in the first couple of years, it was very traumatic for me. Anytime I needed to do that sleep thing, that was always very difficult. But the alone thing, that I was able to navigate just because I wanted to. In the beginning, when I got back home and I was still in a wheelchair, all I could use was my left foot to try to pull me along in the chair. And if I could do that and manage to get over to the back door and figure out how to open the door, just so I could sit there and look up at the sky with nothing between me and the sky, I was grateful for that. I was grateful for little wins, not big wins. And if I could do that each day, then I'm taking another step in the right direction. And those were the things that I would allow in, those positive things, to keep the negative things away.
Yeah. The negative things take over sometimes. Absolutely. That's just part of recovery, right?
It is.
Sometimes you're having a terrible day and you're fatigued and you're exhausted and the negative thoughts come into your head. And I think if you don't give them oxygen, they tend to fizzle away. But what I mean by that is that you just allow them to be there. You allow them to turn up and exist and let you know what their message is or whatever. You acknowledge them for what they are. You don't make any meaning about them. You don't try and apply a meaning to this thing. Just allow it to exist as something that's going to be fleeting. It'll be in, it'll be out. And then from there, you can move into the next phase, which is a positive experience. And then when that positive experience comes there, then give that oxygen, give that heaps of meaning, give that heaps of time and effort. And then the positives start to outweigh the negatives. And then every once in a while, a negative comes in, and then you just allow it to exist for a little bit of time, and then it goes away. I remember waking up at night and always having to go to the bathroom and then feeling, and then having just really terrible negative thoughts in my head the entire time for years. But I've been noticing recently that my thoughts at night when I wake up to go to the bathroom are trivial, if not silly, and they're not about negative things. They're just about weird stuff that I would not normally think on the normal waking hours. So it has shifted for me, but I was troubled at the beginning by some of those, I don't know, I suppose the word is some could they have been? Just, I'm not sure. I can't even describe it. They were just not nice thoughts, and then they were very quickly looping into even worse thoughts and so on. But eventually, just gave myself the opportunity to know that they are just thoughts. That's all they are, and they don't mean anything. They're not going to come true. It's just something that's happening to me at the moment, and I was able to let it go. But I didn't wake up with the inability to move, my entire body. So I don't know what that's like. And I don't know how good I would have been at the beginning to try and understand how to let go of control. And not that I was a real control freak, but you're controlling most things in your life in some way, shape, or form. And then you wake up and you don't have control of your body. I can relate to your not knowing where your body parts are. I can relate to that briefly because I kind of didn't know where my left side was. But at the same time, how do you give up control when you wake up and the first thing you realize is you don't have the ability to move your body?
When you first wake up to that, you're screaming because yes, that control's not there. It's gone, and you have no control of when or if that's ever going to come back. So that's where you've now got to make the decision. Are you going to let that rule your life, or are you going to move on? When I was moved from the hospital wing over to a rehab facility days later, they moved me into a room with a gentleman that had diabetes, went into a diabetic coma while he was driving his pickup truck, lost consciousness, wakes up 2 weeks later, and he's lost his right leg below the knee. And he was extremely depressed. He was giving up, didn't want to listen to the doctors or the nurses for rehab. And every evening, 2, 3 o'clock in the morning, neither one of us could sleep. I would talk to him and try to motivate him and tell him, your life's not over. All you need is a prosthetic leg and you can get on with your life. Little did I know at that time, the nurses' station was right outside of our door, and the nurses would sit there each evening listening to me, trying to motivate him. And it started working. I did everything I could to talk to him. And here I am, paralyzed from the neck down, trying to tell him, look, life's not over. Now, for me, I've lived a full life at 49. I was accepting of, if my life ends right now, I'm okay with that. I don't have any regrets in my life. And I was very much a question mark every minute of every day during that period of time. But that wasn't stuff I was going to let in. All I was motivated toward was figure out what you're going to do next, because there's no instruction book here. Eventually, they moved me out of that room because they knew time was coming for him, and it looked like he was going to lose his life, and they didn't want me in the room at that time. And it really depressed him when they moved me out. But I told him, look, I'll just be a few doors down. I'll come and visit. To go further forward from that, yes, he did eventually lose his life. But as I was healing over the years, day after day, week after week, month after month, and year after year, anytime I was having a bad time, I would think about that man. And no matter what I was feeling, I was not going to give up or give in to what he was allowing himself to give into. I felt very bad for that. And I wished more than ever I could have said more to help him get beyond what he was thinking. But I was not going to let this paralysis define me. I knew I could find my way through this and find my way back. Was it a question mark? Absolutely, every day. But that was not stuff I was willing to let into my brain. All I wanted to think about was finding my way back. When I would go into the uh, physical therapy gym, when I would get wheeled in there each day and sit in a sea of wheelchairs, and my therapist would come to take me to try to teach me how to walk again, I would tell her, I'm here to work. I'm not here to talk. So, stand my body up, even though I can't feel it, and help me figure out how to move these things underneath me so I can make this walking thing happen again. And she asked me at one point, what drives you? And I said, do you see all those people over there with spinal cord injuries who are never going to walk again? I'm trying to put one foot in front of the other for each of them. To me, it's more about them than it is me. But that's my motivation. And those were the kinds of things that I kept in my head over the years to keep me moving in a positive direction.
Pretty good, man. Pretty, pretty, pretty fair approach. There's something to be said of that real win at all costs almost approach, regardless of how battered and bruised and unable you are to continue in the exact same way that you came into the whole game. It's just win at all costs. And that attitude was something that perhaps I didn't appreciate, because I didn't like that idea of winning at all costs, because there's some stigma attached to it, which is, basically it doesn't matter who you leave behind, but and the damage that you cause, but as long as you win, then that's great. And I can see how that can be construed as negative in a way, because especially if winning at all costs means that you're leaving a lot of people emotionally traumatized or physically traumatized behind you, depending on what you're trying to win at, right?
Mm-hmm.
But here's a really amazing way to take that mentality, that win at all costs mentality, and just make sure that you win this particular game and you end up getting back to your life in some way, shape, or form at your own terms. And I don't remember being so forward to my physical therapists at all. I don't remember having those types of conversations with them. But I was certainly motivated to walk again and walk out of therapy and go home early and do all those things. And I think I did pretty well considering. But, I'm just putting myself in your shoes, and I can't see myself whether my emotional and mental state had developed enough by the age of 37 when this all happened to me,
Mm-hmm.
to know whether or not I would have taken a path like you. Yeah, I'll never know, and that's okay. But I'm just finding your conversations really interesting because it's making me reflect. And it's been a while since I've reflected on my own ability to do those things that you said the way that you've said them, which is to win at all costs almost. You didn't say those words, but I love that approach. And maybe it's something for other people to contemplate, whether or not they are being too passive in their recovery, whether they are going for it enough, whether they are telling people what they need to do to get to the other side. And I'm not here for a conversation, for example. The wrong therapist might have thought Jeffrey's a bit of an idiot, talking to me like that. But hopefully she didn't take it that way, because it wasn't about her, really. It was about you, wasn't it? It was about, we've got work to do, we've got a job to do, and let's get to it.
Well, she would cry. She was amazed by my determination to not give up. And that always uh, shocked her that I had that motivation within me to do that. The first day they wanted to put me behind a walker and say, hey, we're going to stand you up now. And we want you to just see what it feels like to stand and hold the walker. And there's somebody behind me with a wheelchair just in case I fall backwards. And I said to her, what is it that I have to do to pass whatever I need to get out of the hospital as it relates to this walker? And she said, well, you need to be able to walk 50 feet unassisted. And I said, great. Well, while I'm standing here, tell me where 50 feet is. And she said, well, from here to the door to the physical therapy gym. And I said, well, okay, then get out of my way. And I couldn't feel my legs. I could figure out how to put something in front of me one step at a time, but I couldn't feel either one of them. And I set out right there, right then to do the 50 feet. And she cried the whole time I was doing it. She eventually took the wheelchair from the assistant and bashed it into the back of my legs and made me sit. But that was my motivation. The other thing that motivated me during those periods of time was don't make it all about you. Everybody that comes to visit you, they see your trauma. They sit in fear thinking, what if that had happened to me? What would I do? And for me, it was, what can I do to get your mind off of that? Is there something I can say to get you laughing about something? Can we have a conversation where suddenly we're remembering something before all this happened to me that we all laughed about, even if what we were laughing about was me? So if I could do that, that was positive fuel for me too, to help me on my quest to get things back. And I had to realize along the way that most of what I was doing was a leap of faith. Okay, you can't feel now. Fine. It doesn't mean you can't try. So do that. Don't sit there with the mindset of, well, I can't feel it, therefore I can't use it. Redirect the energy now.
Mm.
Build a different mousetrap. And okay, you can't feel. So you're standing there. Obviously, there's sub signal starting to make its way through. So work with it, see what you can do with it. But don't let yourself get so locked in and focused to the physical aspects of it that you forget the psychological aspects of it, which are, you got to live your life too. You've got to figure out how to move yourself forward and move yourself away from the stuff that's depressing. What can you do to help facilitate that? And those were the things on my mind all the time. Try to help relieve some of the stress on everybody else. And if I could do that and bring smiles to people's faces, then I know I'm still in the game. I'm still in that game of living. And yes, it's going to take a while to redefine things and figure out where that's going to go because it's all a question mark. But each day is a gift. So be thankful for the gift and be thankful you're still alive. So
Yeah.
have that mindset.
I like your goal. Where's the goal? 50 feet. Where's 50 feet? It's over there. I love that, visualizing the goal, knowing where the goal is, and then just going for it. And at least you know where it is now and you know what you're working towards. That was, I think, a great question to ask. Time to get to the goal doesn't matter. How many times you fall over doesn't matter. How slow or how quick doesn't matter, as long as you know where it is so that you can keep moving towards it. I think that's brilliant. And what you said about focusing on just the physical part of it and not paying attention to the emotional part of it or the psychological part of it. But that's really the two most neglected things in stroke recovery are
Yeah.
emotional and psychological. Everybody does what they can see. Okay, Jeffrey can't walk. Let's get him back to walking again. And I think that's really important because that does shift the psychology of the recovery to the positive. That definitely does do that. It doesn't necessarily impact in the same way the emotional part of the recovery, just like it does the physical and the psychological part of the recovery. So the emotional seems to be the most neglected thing. I asked my followers on Instagram, who here has paid attention to their recovery in these areas, emotional, physical, and mental. And most of them said physical and mental. Mental was a distant second, and emotional was like far away, like third. So um, it's a it's a recipe. This recovery thing is a recipe, and you've got to take each
Absolutely.
ingredient, and you have to access it and add as much of it as is necessary. And you can't leave one part of the recipe out because you're going to get a shit cake at the end of it. You really,
That's correct.
we,
That's spot on.
we really need to add all the bits and pieces to the exact amount that's necessary. And you might not know the amount at the beginning of how much emotional recovery you need to make or how much psychological recovery you need to make because you've never done it before. You've never made the cake before. So you're trial and error. You're doing trial and error, and you've got to get curious about, if I've still got a shit cake at the end, how do I make this thing taste sweet again? How do I make it actually rise and look like a proper cake and look like something that's appetizing? And this is the thing. This is what I think we don't spend enough time doing in life generally. And then we don't have enough of those skills from life. And now we're dealing with stroke as well. So we've got all this extra crap that we have to deal with. And what needs to happen is we need to draw a line in the sand and go, all right, I've got to evolve as a human being. I can't be as dumb as I was before the stroke. I've got to be smarter than that now because I've got more challenges to
Yeah.
deal with.
Yeah. I found in the beginning where I thought this was 80% physical and 20% psychological. And as time went on, I kept finding over and over again, it was the exact opposite of that. I'm beating myself to death physically to get things back, and little by little things are coming, but I'm forgetting that other component of living and what that means socially with other people, to get back into that game again and be social. And how do you do that with your restrictions and feel like, yes, you're part of this thing and you don't feel uncomfortable? Well, even if you feel uncomfortable, go do it. Keep doing it and grow that muscle memory so you get away from it being uncomfortable again. I still remember my uh, neuromuscular massage therapist, Jackie, telling me one day after I learned how to drive again, she said, you need to go take a drive up into the mountains and go take a drive up there and go to this one place with an overlook, and just look across the mountain range. Don't think about anything, just look. And I did that. And suddenly I started realizing more and more I needed more of that kind of mindfulness. I needed to be aware of what was going on around me, that component of living. So it's not turning into everything you just described there, which is absolutely spot on. How do we get away from that thing? And we have to learn those things. It's, again, not something that's in an instruction book. We've got to figure that thing out on our own. And this would be where I'm so glad that you're doing what you're doing, where people that are in the midst of our restrictions and disabilities and limitations, they can come and listen to your show and they can hear these exact things that they're going through and realize, hey, I'm not the only one dealing with this. And here's some great ideas to help me succeed and move myself along into that place where I suddenly realize, oh, I remember now how to smile again and go enjoy my life and laugh. So it's important that we figure it out. And in the beginning, it's all chaos and confusion.
Yeah, to say the least.
Yeah.
Mate, the book is called Finding Forward. You Have the Will Within. It's available now, is it? Is it just out, or is it being released, or?
It's going to be released next week, Tuesday, November 16th.
Okay, fantastic. For people who want to reach out and connect with you, where's the best way? Where's the best place to do that?
You can reach out to me at my website, jeffreymorse.com, JEFFREYA Morse, MORSE.com. You can equally reach out to me on Facebook, Instagram, and Twitter. Facebook, Jeffrey A. Morse, or just type in finding_forward for any of the social media, and you can reach me there as well. And I'm happy to talk to everybody and anybody that wishes to reach out anytime.
It's been a pleasure getting to know you for about an hour. I really thank you for your time. Thanks for reaching out to me as well and asking to be on the show, telling me about your book. It's really important to me to connect with people from all over the world. Anybody that's listening that would love to be on the podcast, just reach out. That's all that Jeffrey did. They just reached out, and here we are. So I love to hear from people from all around the world. I've got this strange thing where I need to talk about my stroke, the strokes, other people's strokes all the time. I can't do it with my family and with my wife and with my, I'm going to drive them insane, but I can do it with all these strangers all over the planet. So feel free to reach out. I will have all the links to be able to get Jeffrey's book in the show notes. I will have all the links to Jeffrey's social media in the show notes so that you can easily find that. Feel free to reach out to me or to Jeffrey to get a copy of that book. And at the bottom of the book, at the end of the book, in the last few pages, there's some amazing images of that trip on the paraglider in Nepal. And they're pretty inspiring.
It was a trip of a lifetime. Enjoyed every minute of it, and I'm so thankful every day for everybody in my life. It's such a pleasure to meet you and to talk about these things. It's so important that we talk about it. That's what helps us to heal. It's very, very important. And I cannot thank you enough, Bill, for having me on your show. This was absolutely spectacular. It was a real honor and a privilege to sit and talk with you about all this. And I hope people will reach out and know that they're not the only ones going through this. And there is a way forward. There is a way into this new life of yours. So live it. Be grateful for every day that's given to you now. You survived and you're okay. That's the most important thing of all. So thank you immensely.
Thanks for being my guest. Thanks so much for joining me on today's Recovery After Stroke podcast. Do you ever wish there was just one place to go for resources, advice, and support in your stroke recovery? Whether you've been navigating your journey for weeks, months, or years, I know firsthand how difficult it can be to get the answers you need. And this road is both physically and mentally challenging, from reclaiming your independence to getting back to work to rebuilding your confidence and more. Your symptoms don't follow a rule book, and as soon as you leave the hospital, you no longer have medical professionals on tap. I know for me, it felt as if I was teaching myself a new language from scratch with no native speaker in sight. If this sounds like you, I'm here to tell you that you're not alone and there is a better way to navigate your recovery and rebuild a fulfilling life that you love. I've created an inclusive, supportive, and accessible membership community called Recovery After Stroke. This is an all-in-one resource program, and it is designed to help you take back your health into your own hands. This is your guidebook through every step in your journey, from reducing fatigue to strengthening your brain health to overcoming anxiety and more. To find out more and to join the community, just head to recoveryafterstroke.com. See you on the next episode.
Importantly, we present many podcasts designed to give you an insight and understanding into the experiences of other individuals. Opinions and treatment protocols discussed during any podcast are the individual's own experience, and we do not necessarily share the same opinion, nor do we recommend any treatment protocol discussed. All content on this website and any linked blog, podcast, or video material controlled this website or content is created and produced for informational purposes only and is largely based on the personal experience of Bill Gassiamis. The content is intended to complement your medical treatment and support healing. It is not intended to be a substitute for professional medical advice and should not be relied on as health advice. The information is general and may not be suitable for your personal injuries, circumstances, or health objectives. Do not use our content as a standalone resource to diagnose, treat, cure, or prevent any disease for therapeutic purposes or as a substitute for the advice of a health professional. Never delay seeking advice or disregard the advice of a medical professional, your doctor, or your rehabilitation program based on our content. If you have any questions or concerns about your health or medical condition, please seek guidance from a doctor or other medical professional. If you are experiencing a health emergency or think you might be, call 000 if in Australia, or your local emergency number immediately for emergency assistance, or go to the nearest hospital emergency department. Medical information changes constantly. While we aim to provide current, quality information in our content, we do not provide any guarantees and assume no legal liability or responsibility for the accuracy, currency, or completeness of the content. If you choose to rely on any information within our content, you do so solely at your own risk. We are careful with links we provide. However, third-party links from our website are followed at your own risk, and we are not responsible for any information you find there.